Starting today, everything you know about the band, I want you to forget it, okay? Because I'm here to tell you, the band has nothing to do with weight loss, all right? And what do I mean? We can take anybody on any diet. I can take anybody with any surgery. And I can promise you one thing, anybody can gain weight on anything, okay? There's decent diets out there. You know, Weight Watchers isn't bad. I'm not endorsing Weight Watchers, but it's not bad. We put you on a high protein kind of Atkins kind of a diet. There's other diets that work. Surgeries, I believe in the band. The band works. Gastric bypass patients lose weight. Stomach stapling patients lose weight. So there's all this stuff out there that's halfway decent that's trying to help us. And yet we're still gaining. So I propose to you this. Maybe the problem isn't the stuff trying to help us. Maybe the problem is us. Okay? A lot of us and we in my talks with you guys because I'm you. All right? I'm one of you. All right? I used to weigh quite a bit. And just preaching every day and I'm starting to believe in what I preach. It's starting to work. So I'm one of you. So what I mean by all of this is that the problem is us. And what I'm getting at is we have a real dysfunctional relationship with food. Okay? I go so far and I truly believe it's an addiction. An addiction in the true sense of the word. Okay? Same as alcohol, same as drugs. Okay? The deal is part of recovery from alcohol and drugs, out of sight, out of mind. All right? Meaning, you notice I said part, but it's out of sight, out of mind. Meaning you don't go around it, you don't hang around it, you don't go to the pub, you don't hang out with a dealer, whatever it is, okay? You don't need it to live. We're dealing with food, and you kind of need food to live, all right? So you're addicted to something you need, all right? In lies the problem, right there. You're addicted to something you need. And what is that addiction? How does it feel? What happens? All those things. You know, we all can go on a diet here, all right? You name the diet, I don't care. And we can all be successful for 2 or 3 months. And after 2 or 3 months, all of a sudden one day, life happens, all right? And I'm on film. Can I cuss on film? Shit hits the fan. And and lo and behold, on that day as well, there's that pan of brownies, that gallon of ice cream, that plate of cookies, whatever is sitting in front of us, and all of a sudden, bam, it's gone. Okay, that feeling, that urge, that feeling of I'm stressed, life is crazy, I gotta eat. All that stuff, that's the addiction, okay? So not only the feeling, but how you react to it, all right? So what needs to happen? Well, you gotta change your life. You gotta change your life with respect to food. What you eat, when you eat, how often you eat, the order with which you eat, everything, okay? Stuff like that. Is it that complicated? No, it's not. It's actually quite simple. You all know how to lose weight, right? You all do. Okay? It's just a matter of doing it. Okay? Got to change your life. Doesn't happen by next week, not by next month, a little bit by next year. This stuff is, as with any addiction, is for the rest of your life. Okay? And as I preach to people, look, if you can make a better choice 50 to 70% of the time, you'll lose weight. Okay? You notice I didn't say perfection. You notice I didn't say failure. About 50 to 70% of the time, you'll lose weight, I promise. With or without a band, I promise you. Where are you at right now? Probably 25. Something like that, you know, depending on the time of year, what's going on, everything, okay? Case in point, I had a patient in my office today who happens to be a physician, who happens to have a Betadine. And she looked at me and she says, she's 6 months into it, and she says, I think I get it. I said, what do you mean? She goes, the band is nothing. She goes, it's all right there. And she's right on the money. She really is. Okay? What we try to do, and what my goal for you is to realize, is that no matter what diet, no matter what surgery, it's still up to you. Okay? When you get to that point, that acceptance, that realization, you're going to lose all the weight you want. Okay? It's still up to you. There's no magical cure, I'm sorry. There's no pill I can give you to all of a sudden be thin. It's just not. It's up to you. Okay? All this stuff I'm talking about, that's what we do here. It's about 90% of what we do is work with you to change your life. Okay? And we'll always be here. You know, I still see my very first band patient I did 5 years ago. Okay? That's the key. That's the other thing that this physician said. She said, your preoperative stuff and your postoperative stuff is what saved my life, not the band. And she's right. You know, and Lisa does a wonderful job, the dietitian, and Angie's coming around, and we're looking for other avenues, nurse practitioners, PAs to help us out as well. And so it's a group effort, and that's about 90% of what we do. The other 10% is actually putting a band in and adjusting it. Okay, so that part's really minimal. Okay, I want you all to remember that stuff, that it's still up to you. I will help you in every way I know how. The band will help you in every way it knows how, that you allow it to. Okay, but it's still up to you. Okay, ice cream and chocolate go through that band real nice. Okay, all right. The other thing, and this is more directed to females, not that I'm singling you out, it's just the mere fact that society's been rough on you. Okay, but it's as a whole, it still pertains to men as well. Y'all are here to be healthy and happy. Bottom line, that's why you're here. Okay, that's why you're here to listen to me. That's why you're here entertaining, possibly putting this in, possibly changing your life, possibly losing weight, all those things. To be healthy and happy. Health and weight loss, hand in hand. You gain weight, you're less healthy. You lose weight, you're more healthy. It's proportional. It follows. Okay? That's a simple one. Happiness, the real reason you're here, okay, because of what society has done. You look at the TV, you look at the magazines, you look at the movies. Anybody who's skinny is a hot chick, hot guy, great life, smile on their face. Happiness, the real reason you're here. Not so much. It doesn't follow like health does. And what do I mean? Well, everybody in this room, if you choose to do so, you can lose 100 pounds in a year. Okay? Guaranteed. Promise you. I can promise you one thing from that aspect. The only thing that's going to change is your physical appearance. Your outsides. Everything on the inside. Who you are. What makes you up. What you like. What you don't like. Favorite food. Favorite movie. Love for your kids, your wife, your family, your children. Everything. You. Your personality. Your emotional state. You. Does not change. Okay? Why do I bring this up? I bring this up because you guys have taught me. And what have you taught me? I have our very first band patient, 110 pounds, 10 months. Okay? Linda and I lost track of her for 2 months because she's a busy gal. Came in the office that last couple months. She was down 20 or 30. We didn't recognize her. She was in so many phrases of the words, she was hot. Bottom line, she looked great. You know, Linda and I fell off our chair. We couldn't believe it. I sat down with her in the office and she looked at me and she said, you know, Bill, I looked in the mirror this morning and I still look the same as I did 110 pounds ago. I was like, what? And since that time, 5 years ago, hundreds of times have I heard that said. I've also had people in my office break down after 2 or 3 years with the band, losing their weight, look at me and say, you know, I'm just not happy. Okay? Why do I bring all this up? I'm never, ever, ever going to tell you how much to weigh. I've had too many people telling me how much to weigh my whole life. That sucks. Okay? I don't believe in that. However, if I'm a weight loss doctor, I got to have something. I got to have some rules. So, I have 3 rules. And that third rule is that when you're all done, you have the ability to look in the mirror and smile. Okay? So, my point is this. If you hang out with us, you come to this clinic, you're going to hang out with us for 6 months. See us every month. See me, see the dietitian, get Lynn's abuse. You're also going to see a counselor. All right? Then you're going to go on a 2-week liquid diet before surgery. So all liquids for 2 weeks. Then you're going to have something surgically implanted in your body. Then you're going to go from a liquid diet to regular food over a 3-week period. Then the work starts, and then you're going to see me every month, every other month, for who knows how long. And trust me, if it's up to me, you'd continue to see me for a long time. If you're going to go to that extreme to change your physical appearance, that amount of length of time, that much devotion, that much, whatever you want to say to put into this, why, oh why? If there's something you need to work on, something about you that needs help, people around you telling you you need help, whatever, wouldn't you continue to see the counselor, see a psychologist, psychiatrist? You want to talk to me, talk to me. You want to talk to Lynn, fine. Pastor, priest, friend, whatever. So that when you come out on the other side, you're happy. Okay? That's what I want for you. Weight loss to me is secondary, to be honest with you. I want you to be happy because I know that's why you're here. Okay? All right. Diets don't work. All right? Success rate of diets, meaning losing the weight and keeping it off for a period of time, years, 5%. Okay? It's not very much. So with that in mind, in walks surgery. Surgery's been around a long time. Surgery for weight loss has been around a long time, since probably the 40s or 50s. It's just come in vogue over the last 10, 20 years. Okay? Why is that? Well, because a third of our population is obese, 60% is overweight. Obesity is the 3rd leading cause of death. Okay? Back in the 50s, I was just talking to a farmer today in the office, and he was talking to me about this stuff. And he's not overweight by any means. He's not underweight either. But we were talking about the 40s, 50s, and 60s, where you could have that pound of bacon, those 3-4 eggs, whatever, and you'd go work. You'd go work in the field. You'd burn it all off. Today's day and age, you still eat the same, but you can look around my office right now, and everything has made my life easier. All I have to do is sit on my butt and let it do it for me, right? So we're very automated, computers, internet, all that good stuff, So we're more sedentary, meaning we sit on our butts more, and we eat more. Food's more accessible, everything, okay? That's why what's happened is what's happened over the last 30, 40, 50 years.